I've been specializing in treating adrenal fatigue for about 20 years, a little over 20 years now, and my predecessor did it 30 years. By all means, share any comments or questions with us in the comments section. My team is standing by to field those comments, and as you join in, let us know where you're from. We're always curious. We've got patients all over the country, and even some international patients that will listen in at times and ask questions. The information out there about adrenal fatigue is so, so diverse, so misunderstood, so confusing, unfortunately. We're trying to make some sense of all of that. Is adrenal fatigue linked to PCOS? It absolutely is. So your ovaries, your thyroid, and your adrenals, they kind of work the same, in that, those glands sit in the periphery. They're all governed by the hypothalamus and the pituitary in the brain. Now, I used to think of those as a three-legged stool: adrenals, ovaries, thyroid, until I actually got into practice and realized I was wrong, because as goes the adrenals, so too will go those other two. If our HPA axis, if our adrenals are overtaxed, that stress hormone goes to the hypothalamic pituitary ovarian hormone axis and thyroid, but we'll talk about the ovaries, and it suppresses it. And it suppresses it in a couple interesting ways. One of those ways is that it sets women up for, menstrual problems of all kinds, including PCOS. We can see even, more significant, that you see fertility issues. You can see certainly dysregulated menstrual menses. You can even see fibroids, endometriosis, all this estrogen dominant kind of stuff. It's this balance between estrogen, progesterone, that is almost impossible to fix if you don't deal with that adrenal problem. Right? So what do doctors do? They're like, oh, your hormones are off, we'll throw you on birth control. That you might fix the hormones, right? That's now you don't get the fluctuation of hormone. You just not fixed it, but put it in cement fix, right? Now your hormones are static because you're taking this pill, as opposed to flexible and fluid and dynamic, right? Which can help with some of the symptoms, but it doesn't fix the underlying problem. When you fix the adrenal problem, the HPA axis, get your body out of fight or flight, now you're not suppressing your hypothalamic pituitary ovarian hormone axis, and everything normalizes. Everything normalizes. I see PCOS go away. I see the weight go away. I see the insulin problems go away. The lipid levels. I see the fertility issues go away. We've had patients who could not get pregnant because they're in stress physiology. We shift that physiology, and now they can get pregnant numerous times. So absolutely, there's a strong connection. Okay. Please reach out if you have further questions, concerns. I'm happy to try to answer any questions. I do have patient coordinators. If you're interested in getting a higher level of care beyond just the information, that's a complimentary call, so we can kind of set you up with that. Just leave a comment in the comment section, and please share this information, right? Like or subscribe, whatever platform you're on. Like, subscribe, share it, follow us, whatever it is you're supposed to do with these things, because getting that information out, this is my goal. For 20 years, once I figured out what's going on with me, I have dedicated my life to researching and researching the condition and helping patients get better from this condition, which is debilitating. It's debilitating. It really is. And I've been there. I know how challenging it is, but there is hope. There is hope. You just have to, you need guidance, right? You just need to be guided in the right way to figure out what your puzzle looks like. You can do it. You can do it. So hang in there. All right. All my best. Take care.